I am pleased to introduce Sue Lohrbach. Sue has been working in supervising practice in child protection and mental health services for 30 years. Sue has come all the way from Minnesota, America, to present to us on common pitfalls and pathways in child protection practice. She is the Executive Director of the KVC Institute for Practice, Improvements and Innovations in Child and Family Services, and is passionate about improving child and family well-being in the US and the rest of the world. I'd like to ask Sue to come to the stage.
Thank you, Jack and Claudia. I'd also like to open with the acknowledgement of meeting on the land of the Gadigal people, the Eora Nation, and would pay my respects to elders, past, present, and future, and all First Nations Aboriginal people present today. Thank you. I also extend my thank you to Kate and Elaine and Danny and Sarah and Paul for your gracious welcoming and hospitality. And thank you to all of you. It's a privilege to be here. Whether you know it or not, you are actually in my future, so I was able to travel 16 hours from the past into the future. And the pitfalls of doing so are too numerous to really sort of detail at this point, but let's just say the dark forces were hard at play in the universe, trying to separate us from having this time, so we'll figure out what that means at some point. So I advance this by this, okay. This is commonly referred to in contemporary times as North America, and I will show you where I live. I'm severely jet-lagged with a laser pointer, so hopefully I'll keep it pointed this way. So here's where I'm from. Minnesota, on the land of the Great Sioux Nation. Minnie, in the language of the Sioux people, would refer to water, and soda, sky-tinted, so referred to the land of sky-blue water. So I live in the prairies and the woodlands and the subarctic areas. I work now at a sort of national and international level, so I'm just going to trace the laser pointer sort of where my office in a bigger sense is today. So here up into Canada, Saskatchewan in particular, California, into Kansas, Nebraska, West Virginia, Kentucky, and spend a lot of time in Washington, D.C. at this point. So as we enter into the subarctic, you're starting spring and summer. We are heading into fall and winter, which for us is probably about 6 months long, and so this are the children in the backyard as we finished in April our winter and we begin again. Here's a slide that is common for us. I could tell you stories where I brave a snowstorm, a blizzard, pretty much like this, to land in Washington, D.C., where the government was basically shut down by a small dusting of snow that I actually took a picture of. This is actually my son, who was the youngest train engineer, his love, since he was 2 years old. So at 19, he was manning the engines for Canadian Pacific, so this is actually him a couple of years ago at the controls. So today I'm going to talk about pitfalls, and by pitfalls I mean the hidden hazards. Sometimes they become visible, sometimes probably far less visible. And the pathway, which is forward thinking, sort of a way out of that. So that kind of a paradigm shift. The overarching pitfall, and remembering I'm coming from another part of the world, is the child welfare focus has become decidedly preoccupied with the function of child protective services. So there actually was a time, particularly in the United States, and a lot of other countries have followed some of the examples, both good and bad, I suppose. There was a time when child welfare was more broadly regarded around the needs that families, children, and young people have. It spoke to the health and education and support services that particularly addressed the geographical distances across the U.S., sort of a vast land area, 300 million people, really addressing those gap areas. Then in the 1960s, the early 1960s, with the advent of the battered child syndrome, where the focus was on the less than 10% of the egregious harm, broken bones, brain hemorrhaging in children seen in the emergency rooms, and the subsequent mandated reporting laws, the system became reorganized from a more holistic, needs-based child welfare system into that of child protective services. And so the pathway here is to reframe over time the service conversation and try to right-size a system that was intended to sort of serve in one area and became sidetracked significantly by another. And so although they tend to be variously referred to as the child welfare system, child protective service system, to be clear, in the U.S. we have a child protective service system. So part of the journey, and you'll recognize some of this in, I imagine, your own journey, was a system that had focused more holistically on families, children nested within extended families, culture and community context, became very, very focused around incident-based ways of responding, to the point where there were almost like blinders put on the sides of practitioners and others who were serving the system to really look only at the incident and to take that into the strongest consideration. In the United States, the Child Protective Service system is a help-sitting service rather than a help-seeking service, so it tends to wait until things have happened. So you're always looking retrospectively at harm that has been done primarily to children. We are a democracy, and so facts and the fact-finding are very, very important to try to manage the procedural due process and the rights of all involved. We also discovered that it was a very paternalistic system, and by that I mean that families would be met with an expert point of view. You know, I am the expert, I know exactly what has happened here, we have the right information, we're going to tell you what to do, and should you be unwilling to follow our directive, then we will utilize the leverage of the court to compel that following. It was a system that functioned in isolation, rarely had any collaborative spirit at all, and unsurprisingly became very adversarial. So courts very active, families very angry, very tense relationships through time. What we've moved to, for many reasons and taking advantage of many opportunities, I think is a system that is much more ecologically focused on the whole of the child and family context. We're still interested in the incident because it gives us information going forward. However, we're going to do much broader and stronger assessments, so making more space beyond an investigative forensic kind of approach to a more family-centered assessment looking at the holistic view. Past incidents and history of children being hurt are still predictors of future likelihood, so we are interested, obviously, in past history. However, we are also going to be more forward-looking about what can we do today to prevent these sorts of things from happening again. To get tangled up in the idea that somehow we're going to be able to sort this information and get it right, and that it is impossible to intervene until we sort of have that all lined up, is a serious disservice in the developmental timeframes for children. And so while that information is being gathered, families are absolutely particularly relevant and important in all phases of assessment, decision-making, and planning. We still have to adhere to the fact-finding. However, we're going to be much more concerned now about the needs and the needs that are beneath some of the behaviors that are seen in the system. We have found no use at all for paternalism and have replaced that with partnership, meaning building working constructive relationships between families, family members, extended family, and service providers. We're moving from an isolated system to one that is much more collaborative. Some of the difficulties there is that the infrastructure that is built within the existing child protective service system still serve isolation rather than collaboration. So there is continuing work to be done there, and I'll say a bit more about that later on. Adversarial posturing can be replaced by a more collaborative focus on settlements and common agreements. And that brings with it sort of its own set of issues. There's an entire industry built up around the child protective service system. And so when one part of the system actually makes improvements or changes, there's a ripple effect into the other areas of the system. And you begin to see very clearly the incentives and disincentives in terms of, unfortunately, who may benefit from continued vulnerability of children and families. And so it's a very, very long road that takes enormous courage and tenacity to continue to push the envelope in a system that was designed to maintain the status quo rather than suited for innovation. And all of the sort of shift has to do with what is commonly understood around the outcomes of safety, well-being or wellness really, and permanency, which at its core is the stability and security of care for children. So I've kind of put these into 10 pitfalls and then sort of answering responses. I think I really like even numbers, and that's why I came up with it. For a while I thought, I could do the David Letterman thing with the 10 tops, and so pitfall number 1. Practice has been hijacked, so overtaken, by the function of case management. So practitioners have actually, and probably unintentionally in the beginning, been de-skilled in the actual delivery of meaningful intervention. And what that has resulted in is a kind of a brokerage model of find a need and plug in a service, and then sort of relegated to monitoring the services, bringing in probably much more service provider into the mix, which actually can increase the dangerousness. The more people that you have involved with young people, children, and families, without any coordination efforts at all, the more gaps there are in terms of the fragmentation of information. And I think that is well supported in the literature around child deaths that looks at contributing factors that go something like this. There had been a bit of information. Had it been shared at a common table, might have prevented an egregious outcome for this particular child. So where services or service providers are involved, the effort is really to bring all of those service providers together with the family, its extended family system, children and youth included, and to sit at the table basically and work everything out and figure out what's necessary, what's unnecessary, and who's doing what. We have an awful lot of complacency in our systems about somehow if there are more eyes on, things will be safer. And the reality is, if the eyes are unfocused and think that other eyes are the eyes that are on, then you have gaps that can create very bad things happening. The other sort of unintended probably, but nonetheless consequence of a brokerage model is it can support and contribute to high caseloads, high workloads for practitioners, because all of the sort of intervention work is being outsourced, so to speak, and then it's sort of in running around and managing compliance to that. So pathway, workaround, whatever, out of pitfall 1. is the recognition that the practitioner is the intervention, and that every interaction of every single day represents that intervention. And every intervention must be an interaction. It is the ethical way to operate in terms of working together with a degree of reciprocity. The development of a working constructive relationship allows for the vulnerability to the possibility that there are other views and truths that are held. And so while there may be tension, the goal is to be very straightforward, to seek a shared understanding, to have common ground on the basis under which the concerns going forward will be remedied. I've been sort of immersed in the neuroscience of adverse childhood events and effects and experiences, as well as the sort of trauma focus that comes across, I think, all of our countries. And so part of a brain alliance between 15 sites among Canada and the US. And so when you think about an interaction, the parallel that's often used, which suits me as a tennis player, is the serve and return notion of a tennis court. And so every interaction and the nature of that interaction is contributing to the building of neural connections and pathways that will in fact set a trajectory for that child and those children, and working with parents as an entry point into actually solidifying those much healthier connections. So entirely consistent with what we know about brain development. Pitfall number 2, sort of following the same thing as number 1, is developmental and clinical supervision has been hijacked by the administrative function. I had the privilege yesterday to spend the day with an entire group of supervisors and managers, and prior to this session, an opportunity to sit with practitioners who both receive supervision and provide supervision, sort of working through some of the perspectives that seem to be common in all parts of the world that function in child protective services. We have overdeveloped procedural and compliance skills and focus, and significantly underdeveloped clinical coaching and supportive skills and focus. And you can see that the administrative functions are actually easier to put in place when the tendency is to de-skill practitioners and supervisors into the context of a more brokerage model or case management model, as opposed to the kind of modeling and coaching and teaching and support and reflective practice and a more responsive and less reactive system that would be required to support a stronger intervention and interaction connection between the service provider, social worker practitioner, and family. Pathway out of Pitfall 2 would be making time for intentional supervision. To slow down. The system has to slow down in order for it to speed up, and the speed up has to be in child development terms. For every moment, we are vulnerable to, in a negative way, to the sort of anxious environment and risk-averse scenarios that we work in, and we're responding with adrenaline, fight, flight, and freeze nearly every day. We are unavailable to be more responsive, and it's much easier to make mistakes. It's also much more likely that we will forget that the trajectories that are sent in terms of working with children will be seriously put into disrepair. So our systems are highly reactive, and the goal is a more responsive system. Slow down. The utilization of learning forums, developing a learning environment is entirely possible. It takes a great deal of tenacity and intentionality to put that into place. It has to do with reworking the infrastructure so that we're actually building new ways of managing within a system that was designed much more as an assembly line. Teaching and coaching critical thinking and judgment skills. This is the acquisition of expertise, which is different from taking an expert posture of knowing better than someone else. This comes from the experiences and mental models and pattern recognition of doing the work every day rather than sending the work out to be done by multiple different practitioners. Another sort of bit that comes from my tennis experiences, our coaches used to always talk about practice makes perfect, as sort of an incentive to keep us practicing and practicing. And the reality over time is that practice actually makes permanent. So what it is that you practice and the ways that you practice increases the likelihood that that's the way that you will continue to do whatever that is. And so we need to develop and support that which we want to see in the work and the outcomes with children, young people, and their families. If we practice it imperfectly, that is how we will move forward. Pitfall number 3 is specialization, and we see this in healthcare as well. The development of silos, so in the sort of assembly line of the Child Protective Service system design, where you sort of have a place where the calls come in, and then there's sort of another space where you do investigation or assessment, and then ongoing field services, and. Those silos tend to run caretaking and competition among them, and there's always tension between the transfer of work. So there's a lot of opportunity for dropped information and negative kinds of practices. It also significantly contributes to the fragmentation of service delivery, sort of that more is better kind of thinking, and can be significantly reductionistic in terms of the ways that families are viewed. Part of what has happened in our system is around language is that we have taken actual resources and turned them into actions. So there are probably an unlimited number of words that I struggle to even say, and 3 of them have to do with the word case, removal, and placement. Family, children, and young people are more than a case. And the longer we refer to sort of cases, the more we run into the possibility of continued objectification. And part of that is a way to sort of manage some distance from the difficulty and complexity of the work that we see. Likewise, removal and placement are also probably far less child development centered. What we're talking about in terms of children are transitions and disruptions, and that is how we would really need to pay attention, I think, to languaging that. There may be needs for alternative care and alternative environments, and there are resources available within family and kin connections and within the stranger foster care system and in other sorts of places, as long as we continue to talk about the actions without the real impact on real life human beings, we risk losing more and more of our humanity. The pathway out of Pitfall 3 is the development of infrastructure to support collaborative practice. And since you are in my future, there are many amazing practices going on here. Group decision-making, group supervision. There are opportunities and there are possibilities to redesign court systems and the way that any part of the system is managed. I mean, at the end of the day, the Child Protective Service system, like many systems, is simply an artificial construct. We've made it up. And it also means that we can thoughtfully rework some of that. Kate, you had put up a quote by Maya Angelou, and there's another quote of hers that says, "We do the best we can until we know better, and then when we know better, we have to do better." And we have known better for a long time, and it's been really difficult to find avenues to put that knowing better into actual practice. So part of the development of infrastructure is children are nested within family systems, extended family systems, cultural community ties, and even along a much larger global environment. And practicing working in groups transfers into working with family groups. So again, sort of that theme of, are you practicing in an infrastructure that will give the very best opportunity to grow the skills and the strategies and the intervention and interaction expertise that is needed in mirroring and delivering an actual service to families. Pitfall number 4, having conversations with people in our heads. Sometimes this goes from the whole range of, kind of the land of what if, to just catching ourselves sort of thinking about, have you talked with, the family member? Well, I think what they would say is, have you talked to the family member? And then, no. So it's like, go back. Or sometimes, and we practiced some of this yesterday too, that questions are asked about, well, how should I approach something? How should I say something? What would be the words that I would use that would be the very best? And the words that they've given are actually the very words that you would say. So it is always held. I can't think of one single time where I've been in a conversation with a practitioner or a supervisor or any kind of service provider who has said, how should I say this? This is really hard to say. It's like, just like how you said it. Just say, I'm unsure how to say this. It's really hard to say. Here's what's in my head, right? Having conversations with people in our heads supports paternalism. It sort of builds that expert sense. And in a false way, it also contributes to a distancing, again, sort of a forgetting about the dialogue. Unasked is unknown, is very different. So without asking someone, you don't know if you don't know. And we're unable to build a relationship unless you view the me, myself, and I as sort of a group process in your heads. Pathway out of pitfall number 4 is to think out loud with people. Particularly when we have responsibility and statutory mandates, there is no way to balance authority. There are simply people in the room that have authority and people in the room who do not. You can utilize authority more respectfully and responsibly. What people without authority want to know is what people with authority are thinking. Right? And so if you think out loud, and particularly if you preface it with the notion that you may be wrong, because we may be wrong, that is very acceptable to people because it's honest and it's authentic, and you're struggling together with something. You're making yourself vulnerable in a good way to the position of another, an openness that allows for the space to have a dialogue outside of your own world. Catching yourself thinking that you know what someone else might say, and ask a question out loud instead in the presence of another. Remember that admitting you may be wrong takes you further along the path of avoiding decision errors. So the work of Eileen Monroe, right? This is how that comes home. Sort of prefacing something with, I have something to say that may be very difficult to hear, and I'm going to apologize ahead of time that I might have it wrong, and then go ahead and say it. Many of the times, one of the sort of barriers to coming to closure in a child protective service system has to do with a concern that has gone unsaid because it is seemingly unsupported by any evidence. And it is that very same nagging thing that will in fact stop that closure, except now we have the added complication that for a family, they think they've done everything that everyone has asked, and suddenly it's shifted. The bar has shifted. And so it is best to take what it is that people are worried about and put it on the table with a clear understanding that it may be just something that you have misinterpreted. And that is what is most respectfully accepted in the experiences that I've had in very tough situations. Pitfall number 5, using jargon and acronyms. It seems like the last 3 organizations I worked for represent acronyms, and so I always feel sort of incongruent because I work for an acronym at the same time. I really, really detest them. And it's surprising what actually constitutes jargon today. I mean, many of our references to approaches and skills and techniques have also become jargon. And we had just a really, I think, amazing time yesterday spending time unpacking some of that. You know, so what does that mean? And then what does that mean? And then what does that mean, to try to get down to a simplified core of that. Jargon and acronyms contribute to authority and power imbalances and misuse. It's an internal language of exclusion. It's very, very easy to misinterpret. Found it to be nearly impossible to translate across languages and cultures. And it is really hard and somewhat embarrassing when asked, and you've forgotten what the letters stand for yourselves. The way out of Pitfall 5 is to discipline yourself to unpack the acronym. Slow down, say the words, or set them completely aside. Spend time in your supervision sessions or your reflective moments or your ad hoc hallway opportunities to just go a little further into what something means. I think the whole the late Dennis Salibi out of the University of Kansas wrote the book on strength-based practice and social work, and unfortunately even sort of the language of strengths has become jargon, right? And what I've seen sort of happen there is, although very well-meaning, an attempt to advance a more holistic and thorough assessment, sometimes the question that gets asked of perhaps a caller with a concern with children is, are there any strengths in the family? Right? So you ask a yes-no question that yields very little information, and what I may interpret as a strength would be something different that you may interpret as a strength. And so what is a strength? So it is even coming to question many of our sort of preciously held strategies and approaches. Seek understanding and simply stop and challenge yourself. Right? These are intrusive thoughts, and you just put in a thought order. Stop. Pitfall number 6, believing that multitasking is a good thing. I remember interviews where you were coached to talk about how you could multitask, how you could manage competing priorities. Harvard has done a study, and the research on multitasking tells us that it increases the likelihood of making decision errors and increases the likelihood of missing key information. I can't think of any place that is more importantly focused on decision making and key information than the work that we do. So the distraction beyond driving and texting and all of that, is also having all of our technology devices and trying to do multiple things at one time. Right. So one more thing about that, it's less about setting up rules, about setting, no cell phones, and it's more about talking with people about what the use of multitasking can end up resulting in, so that you can make the decision about whether or not you want to participate in that and whether or not it is an acceptable risk to miss certain key information or increase the likelihood of decision errors. Pathway out of Pitfall 6, stay fully present, practice mindfulness, give your full attention to the person and task in front of you. It takes very little time to slow down and to have a meaningful exchange, and that slowing down will pay enormous dividends down the road. Catch yourself urging to multitask and stop. This would also be known as self-regulation. Pitfall number 7, getting lulled into thinking that decisions are always clear and made under a bright light. And we have many, many tools that, although very, very helpful in supporting decision-making and all sorts of things, sort of contribute to the idea that there is a clear way to make a decision. Gary Klein, in his book on adaptive decision-making, sort of describes the story that you may or may not heard about a person that was parked along the side of the road, was sort of outside on the ground in the dark, looking for something, ended up being under a street light. Another person comes by and says, "Can I help you? What is it that you're looking for?" "Oh, my car keys, I've lost them." And so they look around, and the other person says, "Where did you last see them?" And he said, "Over there." So, "Well, why are you looking here?" "Because the light is better." So nearly all of our decision-making is adaptive, in the gray and shadow work. We are confronted with multiple streams of enormous amounts of information, with often conflicting information. I have supervised and worked through some of the very most controversial and seriously negatively impacting very, very bad injuries on children. The place where I come from is also home to the world-famous Mayo Clinic, which is an international medical facility. And so there are times, and one time in particular, where I was working in a Child Protective Service context to reconcile the discrepant views of 15 worldwide experts on pediatric medicine. Right? As you're trying to make a decision, you're having to deal with all of these multiple perspectives, and each one being held to a strong position. Pathway out of Pitfall 7, embrace the nature of the gray. Critically thinking and talking through multiple hypotheses. Tools don't make decisions, people do. And people need the support and the skills and the practice and the experience to participate in those decision making. Develop a comfort zone with uncertainty. We used to talk about institutionalizing uncertainty, understanding that you're always juggling multiple balls in the air. And in the United States, the decision to screen in or accept a report of child maltreatment is based on the standard of proof and evidence called preponderance. So preponderance is the lowest standard of proof and evidence. Beyond that is clear and convincing, and beyond reasonable doubt. So we are always working in very, very shadowy places. Share risk and accountability, which can happen as time is slowed down and infrastructure is developed for supervision in peer forums and family groups. Pitfall number 8, forgetting that math matters. Believing that needs equal services and that services equal safety, when what gets measured is compliance, and compliance does not equal safety. So we are heavily weighted on administrative tasks within a compliance-based system in which what suddenly and unwittingly becomes important is the compliance with those tasks. I have never ever seen any research that would demonstrate that compliance with services equates with child safety. And so again, it tends to contribute at the end of the day to being stuck at the point when it seems that closure should be clear. And what we've done is we've only measured compliance rather than meaningful behavioral and observational changes that have impacted children moving from declining to thriving. Pathway out of pitfall number 8, recognize that services equal means rather than ends. Any time that a service is thought to be useful and to put into place, the question to ask is, what is it that you and the family want to see at the end or the conclusion of a service? And then, is it the right service? To recommend parenting education without clearly talking to the service recipient and then going back and discovering that what the parent was hoping for is to stop wanting to stop hitting their child, to stop wanting to hit their child, right? parent education and skill-based processes will not get at the level of self-regulation that she was referring to. Right? Also, here, of all places, you know that you have very remote and rural areas as well as your urban areas, and professionalized services may be less available. And so what are the other ways that one can achieve sort of those ends? So what is it you would like to see at the end of the service, and what are other ways that you could get there? When Paul talked about, which is really the worldwide sort of measure, that 85% of what comes into a child protective service today broadly fits under the category of neglect rather than physical abuse or sexual abuse. Part of what we end up doing within the systems is we come to the point of closure and we connect the family with all kinds of services that in the end are voluntary. And when people get tired of one another for various reasons, and there's no particular relationship or compelling reason to stay connected, those falter, and then what ends up happening is what is known sometimes as frequently referred families. So that which may be situational now becomes chronic, and we see the cumulative negative effects of these kinds of cycling unmet needs that unwittingly become paired with services that may never endure. And so that is where the strength and the wisdom of working within the family, the extended family, cultural and community context, those practical and informal sorts of helping resources may actually do a much better job of an enduring kind of process with families well into the future. There's a lot of discussion about evidence-based practices and what does that mean. I think what we really ought to be looking toward is the application of the process of evidence-based practice. So we want to formulate an answerable question. So what do we know about methamphetamine? What do we know about the effects of methamphetamine on human functioning? What do we know about the effects of methamphetamine on human functioning as it relates to parenting activities such as attention, care, judgment? What do we know about effective interventions? What do we know about safe and effective interactions? And what do we know about prenatal exposure? And then we can build forward. Pitfall number 9, goal fixation. Getting caught up in the belief that the starting point is a clear description of goals. Just like the shadow world of decision making in the complexity of human nature, here it's a myth. Continuing to pursue goals that likely have become irrelevant is in the mix. The way out of pitfall number 9 is to recognize and honestly confront that the work that we do is complex. Where goals are incomplete, maybe in a constant state of change, which I think all of you can identify with conflicting information equates with what Rattel and Weber have referred to as wicked problems. We have to instead think of goals as emergent, requiring reassessment of our original understanding. What looks very neat and ordered on paper is very messy in the lives of the human condition. And pitfall number 10, believing that teaching procedures increases skill and expertise in task performance. Following procedures can actually reduce flexibility, and that flexibility and adaptability, creativity, if you will, is absolutely key in the shadow world of decision making. Teaching procedures can actually interfere with learning skills, a kind of paralysis by analysis, right? So you have so many things in your head, trying to remember them all, sitting down with someone, expected to be fully present, when in fact you're completely distracted by what's in your head, and you become paralyzed in that process, right? So at the end of the day, any practitioner that meets with any child, young person, or family only has on them what they have on them. And if they are without the opportunity to immerse in an everyday opportunity around modeling and rehearsal and practice, what you will be left with is a head so full of things and a paralysis that results. Teaching procedures can also increase the difficulty of developing and applying expertise because the procedures are always, I think, in a state of updating. Would that be true? Yeah. So you will never catch up. So the way out of pitfall number 10, and I'll acknowledge the need for procedures and policy and all of that in the mix. We're talking about overworked and underworked and underdeveloped and overdeveloped, out of balance aspects in the work that we do that is critically relevant. So instead we focus on building expertise. Expertise comes with experience. For every moment that we're in a case management mode, brokering services, we are without the learning experience of building that kind of expertise, those mental models and those pattern recognitions and those anchoring points that come and make sense of what's before us. You know, you could probably identify with either yourself or a child that you're, within the context of your home or somewhere else where you can sort of recognize the symptoms of a cold coming on, right? And you're recognizing the pattern of that. And then you take it a step further. If that child has actually been exposed to other children who may have a strep virus, then you may, in addition to the usual home remedies, you may seek some additional testing for the bacterial infection that is likely based on exposure. That's part of pattern recognition. While each family is absolutely unique, there are patterns in approaching intimate partner violence, serious and persistent behaviors and actions and symptoms of mental health difficulties and drug and alcohol misuse and abuse. Make use of and note of adjustments and improvisations and learn from mistakes. Mistakes tend to be sort of elevated and highlighted to the point that it almost feels sort of futile and beat down. And instead, most important discoveries are made from learning from mistakes. And correcting those going forward rather than sort of cowering in the anxiety of knowing or feeling that one will be significantly taken to task or punished. So there's also a recent study that came out, 2 traits that predict happiness. Gratitude, expression of gratitude, and the love of learning. So when you think about sort of morale in your own lives and the work that you do, taking time to sit in the space of being grateful, of developing and being a part of a system that acknowledges and appreciates and creates space and develops a learning environment will go a long way toward improving the health and well-being of everyone. So, Kate, we're again on the same wavelength with Dr. Seuss. So you have brains in your head, you have feet in your shoes, you can steer yourself any direction you choose. So in the last session, we just talked a little bit about, these are big systems that we work within. In the United States, I think of it as a big machine, actually, that sort of chomps its way across. And you can get caught up in feeling sort of very insignificant in that process. And there is the recognition that the one thing that we know for sure is we can never change the behavior of someone else. And certainly a system and a machine is even bigger than that. What we can do, though, is change our own response. And that's all it takes, is for each and every one to practice differently, to embrace the spirit of the pathways, to recognize the pitfalls, and to do something different. It's all about choices. And creativity takes courage, the quality of mind and spirit that enables each one of us to act in accordance with the practice values which are presented very clearly here in your work, and the ethics, and to persevere despite the difficulty. In the midst of chaos lies creativity. So I'm going to end there. I have no idea what the time is, but I'm going to end there.
Sue, thank you so much for that. Before we let you get out of the spotlight, though, we do have some time for questions. So I'm going to put that out to the audience, both here and online. If there's any questions for Sue? Anything out there? You have to wait 20 seconds. I think there's someone down here.
Jorge from Bathurst. I'm asking this with some trepidation, but you mentioned that the organization where you come from, you see it as a big machine. I call it a monster, and not in an unkind way. In your experience, knowing what you know, and I would say your presentation and the ones that preceded you today are very subversive in a way, in practice, not in theory. In theory, we are aware of the theory. It's the practice that I feel conflicted about. I'm getting mixed messages in my organization. Where you come from, in your experience, has this knowledge made a difference in the way that machine, that big machine operates? And is that translatable to our context, do you think?
Yeah. So has this way of approaching and this knowledge been actually put on the ground and made a difference in either the design or the speed or the sort of ferociousness of the machine? And if so, are there some parallels? Yes, yes. Yes, there have been very, very strong changes. There have been legislated changes looking for opportunities. So like in the United States, one of the strongest opportunities has been the legislative permission to develop differential response systems, which allows for different ways to respond to reports alleging child maltreatment. And so what sort of happened at that point, although it's been an arduous journey in terms of the tendency to polarize, there is a way to respond through a forensic investigation, and there's also a way to respond through a family assessment where you set aside the determination of maltreatment and proceed on a determination of child protective services needed. And what that set in motion was sort of the practitioner and supervisor level of saying, well, if we're no longer going to do this, meaning an investigation, what else do we do? And so there entered, stage left, the opportunity to bring in much more skill sets around relationship-based work, much stronger focus on holistic assessments that take into account the protective capacities and protective factors, and a very much stronger mandate for the beyond engagement of families, the meaningful involvement of families. And once that system is legislated in differently, that is a change to the infrastructure. So, yes. And experience in other parts of the world would be that there are those same opportunities, and there seem to be very strong parallels. The systems have been built as a bureaucracy, and the bureaucracy's job, honestly, is to maintain the status quo. So when you change the infrastructure, you solidify that you are bringing a different, stronger structure that is less likely to fall. Are there always defaults possible? Yes. However, the collective does appear to prevail. So if I go very back to the beginning around sort of resetting with the child welfare system, for us what differential response has done is kind of right-sized. So the investigation which actually suits itself best to the 15%, where there may be physical injuries and sexual abuse. There is another way to respond to the 85%, for instance. Now, those percentages would vary, across the world. The jurisdiction in which we built the practice did move to 90% of responding to families through a family assessment, setting aside the determination of maltreatment, and around 10% of investigation, which changes again enormously the way that courts are utilized, the adversarial nature of the process, the absolute relevance and necessity and meaningfulness of work with families.
Thank you. Do we have any other questions? We've probably got time for one more. No? All right. I might just thank you, Sue, firstly for walking us through the pitfalls and actually articulating them for us. There was nothing in that was foreign to us, sadly, but for giving us the pathway out and keeping us future focused. I really appreciate that you did that. When we had to think about keynotes for this conference, Sue was a no-brainer for us. Sue developed the consultation framework that we use in group supervision in Practice First sites. Through that framework, Sue, we are having the most courageous conversations that we ever had, and we're developing creative solutions for families like we've never done before. So on behalf of everyone here today and everyone that's working under your model, I want to say thank you, including on behalf of our families who are reaping the rewards of our new way of working. Sue kind of undersold her difficulty in getting here this morning. Stay here. It wasn't as easy to get Sue here as we might have thought it would be. We got a very considered email from Sue on Thursday saying that she'd missed her flight. It sent a ripple through the OSP about, oh my God, what are we going to do here? Then we found out over the weekend that Sue was able to catch her flight, but sadly her luggage didn't come along with her. So she's had quite an experience coming to Sydney, and for everything that you've gone through and coming from such a far distance, we're most grateful and really nurture the learning that you've given us. So thank you, Sue.